Ready? All right, so what we're gonna do is we're gonna work on some bend mobility activities, and I'm gonna be out of the camera's way. So I'm gonna be on this side, but I'm gonna work on this leg. So the first position we really wanna get into is hook line, because it is a great functional position. So there's a couple things you can do. You can start with some rhythmic initiation, just to get the patient used to this movement, and just don't do it for them the whole time. So I'm going to passively do it first, and then I want you to help me do this. Okay, and then eventually you're going to get to the point where I want you to go ahead and do that. So, and then you want to facilitate those hamstrings to get them into that position. Okay. The next thing you can also do to get them in this position is take this heel here and then tell them, I want you to bring up your leg so your feet are flat on the bed. And then I'm going to tap here again on the hamstrings. And again, let's do it again. Okay. Tap on the hamstrings because you're trying to facilitate that knee flexion. This, you're using this compensation pattern or compensatory motion to help. The right is going to help with the left. So go ahead and do that again. Okay, good. Now we're here. I'm going to go ahead and approximate. So I'm pushing the tibia down into the table. You can also approximate this way, the femur into the FA joint there, more acetabular. Now that we're here, what we can do is just some simple bridging. And these activities are not meant to be totally inclusive, because I want you to be able to have the opportunity to come up with your own ideas. So the first thing again you want to do is some rhythmic initiation, so they know what they have to do. So some up and down motion. Okay, now that they kind of get that, you can again active assist. But then again, you get them to start doing it and then facilitate. Go ahead and lift your bottom and down. Lift your bottom and down. So let's go ahead and try some combination of isotonics. Slowly let me push you down. So I'm providing resistance on the top. Lift up. Slowly let me push you down. So that's a combination of isotonics. You can go ahead and push up against my hands. Push against my hands. So you got dynamic reversals. Push against my hands. Push against my hands. Or you can do, go ahead and lift your bottom up. If they have this ability, hold to let me move you. Some rhythmic stabilization. Hold to let me move you. So your hands are alternating between either side. Okay, relax. So again, all these things are meant to help with bend mobility. So now let's just say this left side is flaccid, and get the patient to grasp their fingers together. And again, rhythmic initiation here, up and down, up and down. Get them, and if you need to, tap on the anterior delt and the pec region to kind of help facilitate that movement. Or you can get on the tricep as well, wherever the patient needs. And then again, this is going to help with the rolling aspect, and this also helps break synergy at the same time. And now let's go ahead and you can do the same techniques that we just did before. So go ahead and push up and lift toward the ceiling. Hold this. Let me slowly push you down. Yeah, perfect. So again, you're working on that combination of isotonics. So you can pull up, push up again. Yep. And now switch pain position. Now pull down. So then now you've got that dynamic reversals. So you can, lots of different options you can do here. So go ahead and clasp those again. And remember, this is the affected side, so that affected thumb needs to be on the outside. Okay, so let's reach up to the ceiling, and I want you to look to your left, and now go ahead and bring that nice and gently over. Okay, so now that we're here, what we can do is we're going to try to roll. So now try to roll to that side, okay, and you just assist them however they need to. So if you need to do something here, you can hold this, don't let me move you. Hold, don't let me move you. So now we're doing some stabilizing reversals. Hold, don't let me move you. Hold, don't let me move you. So she's just working on some IO-EO activation here as well. And now that we're here, what you can do is let's see. The affected side was supposed to be the right side. So we'll put this left leg underneath. And to get this leg out on this transfer from sideline to seated, I want you to use this bottom leg and try to hook it underneath here, and you're going to kick it out in front of you. Go ahead and try that for me. And I'm gonna go ahead and tap on the quads there to help facilitate that movement. And I'm gonna go ahead and get her off the bed a little bit more. All right, so now what I need you to do, this is her affected arm. So on this affected arm, we're gonna go ahead and put that here. I'm gonna approximate here again. You can even approximate there. And now I want you to push off here as much as you can. And then we're gonna go ahead and sit up on 3. You ready? 1, 2, 3. Okay? Now the first thing you need to do when you get them in this position is really set that pelvis and get them to be nice and proud of their position. And now the second thing you need to do, this is the affected side. So you're gonna get this arm out to about 20 to 30 degrees and facilitate by approximating here. And you can just do some rhythmic initiation for the weight shift. And again, that weight shift will provide some good proprioceptive feedback here and always trying to get them in this good position. So that is going to be good for that.